Dr. Susan Bleasdale joins us as soon as this phone decides to work. There we go. Doctor, good morning.
Good morning.
Nice to have you back on. We appreciate your time.
Thanks for having me.
Medical Director of Infection Prevention and Control at UI Health. Worst flu season since 2014?
Yes, that's the way it looks right now.
So, obviously people should have their flu shots by now, but if they haven't, is it too late?
No, they should still get their flu shot. It's not too late. It's still around. We're starting to see that it's coming down a little bit, but it's still around, and we may see a little bit of an uptick again later in March in influenza B, which is what we've seen in past years. So yes, you should still go out and get your flu shot if you haven't yet.
Dr. Bleasdale, I'm seeing a lot of people. Well, first of all, I see a lot of people, they'll sneeze and say, allergies, not COVID, not flu.
Yeah, because you sneeze or cough and you're afraid you're going to be the scarlet letter
nowadays,
type.
I'm seeing a lot of that. But also, too, now people, if you do have some sort of a cold, and I'm going to use the air quotes for that, you don't know right now if it's COVID, if it's RSV, if it's flu. Have you ever seen kind of a time where everything is kind of getting mixed up and thrown into one?
It is, right? Right now, because of the vaccination for COVID is a lot milder. And really, a cold is an upper respiratory infection, and that's what the flu looks like. That's what COVID looks like. That's what RSV looks like, and several other viruses. So you don't know. When you have a cough, a sneeze, a runny nose, it's some respiratory virus. So it's best, though, to find out. Go to your doctor, get tested, because we have treatments for COVID and we have treatments for the flu. And it's important to know so that you may qualify and you may do better if you get treatments.
What is the time to, go ahead and test at home? You've got cold symptoms. Maybe they mimic the flu, or maybe they mimic COVID. When should you do the COVID test?
You can do the COVID test at home anytime you have a cold or respiratory symptoms. The important thing to remember, though, is that if your COVID test is negative, it could be the flu. So that's why it's important that we don't have a home test for the flu for people to test. So if you're negative, it doesn't mean, okay, I don't have COVID, so I can go to work. It means you're still sick. But the home test is helpful at least to know if it's COVID, and then if it's not, you might want to talk to your doctor. Also, it's important to remember that the home tests are not 100% reliable, in that, it could be negative and you still may have it. Really, the home test is helpful to know if it is COVID, but if it's not, it doesn't really change what you're doing. You shouldn't go to work or school if you're sick.
If it is COVID, however, now, what we know now as opposed to, say, 2 years, 3 years ago is much different. Should you still call your doctor and stay inside for 5 days?
Yes, you should call your doctor, see if you would benefit from Paxlovid, one of the antivirals that helps with reducing the severity of illness, and you should stay away from others stay inside for 5 days. You should wear a mask after that, too, just to make sure that you don't give it to someone else, because you still shed that virus afterwards. And it's the same thing with the flu. You should isolate yourself if you have the flu or any respiratory symptoms. You don't want to go around other people. We saw a lot of increases in the flu and COVID right around the end of the year and the holidays, because everyone gathered, and this was in the height of the flu season. And so we had a lot of people get either COVID or the flu at the end of the year, just being around each other.
Yeah, speaking of how things have changed, we stayed inside for the better part of 2.5 years, and presumably common sense would tell you that our immune system suffered from that. Is that one of the reasons we're seeing spikes in these numbers, or is that not related?
I think this is typically when we see the flu, but yes, probably we haven't had the flu. Really, there was no flu in the fall of 2020 and very little in 21 because we were still very protected. So yes, we're seeing probably a little bit more because people don't have immunity, but we're seeing more because we're around each other more, and we weren't in past years. And so that's the other thing. And And this is a typical flu season in that it spikes around the holidays and the end of the year into January and the winter months in the northern hemisphere as people are just gathering and inside. So it's just an impact of we're more social, we're having more events, we're gathering more, and so we're seeing more flu and respiratory viruses being transmitted.
Segue to that, are you seeing a lot of bronchitis and pneumonia too?
We are. Unfortunately, that is what happens when these numbers go up in the community at large. Lots of people have these respiratory symptoms, and then people end up in the hospital. They end up in the hospital with complications like pneumonia or severe bronchitis or worsening of their underlying conditions like emphysema and heart disease. So we're seeing more people in the hospital. Thankfully, though, because of vaccination, we are not seeing the same level that we had seen during the pandemic from COVID-19. But we are still seeing numbers of complications from the flu. Not many people have gotten their flu shot. And so it's really important to get your flu shot to decrease your risk of hospitalization and death from the flu.
Yeah.
We have to do this every year, and this year's no exception. We have to remind you don't get flu from the flu shot.
Right.
It is a dead virus that your body recognizes and then develops the ability to fight it off if the real thing shows up. That's the very base explanation of how vaccinations work, but that still keeps people from coming because when your immune system turns on, when it sees this dead virus, you feel like you have the flu, but it only lasts, generally speaking, for a few hours.
Right. It was the same thing with the COVID-19 vaccine. And I think hopefully people understand it's the same thing. That's the way your immune system works. That's why the vaccine is so effective, because your immune system is turned on when you get the vaccine and you feel a little bit achy and you may even have a low-grade temperature, but that gets better. And that's much better than having severe COVID or severe flu that can last for weeks. The other thing that's important to remember, too, is that the flu vaccine, it's not going to protect you against getting it, but it's going to keep you from getting it very severely, like the COVID-19 vaccine.
And that's the same with shingles, too, right? Because we have a mutual friend, Susan, who thinks that she got shingles from the shingles vaccine, and that's obviously not the case.
No, that one, you can't get shingles from the shingles vaccine. And that one, the shingles vaccine, the goal of that one is actually to prevent getting shingles from that. It's more effective in that way in prevention of recurrence of having shingles. Because that is from a virus that you've had already, the chickenpox virus, and that's a recurrence.
Right.
All right.
Good to know.
Out of time,
Good
Doctor. But is there anything we didn't discuss that you really want people to know?
Get vaccinated, and just don't forget, don't go to work or school if you're sick. No matter what it is, flu, COVID, just don't go to work or school, because that's how other people get it, and that could get somebody who's vulnerable really sick. So do everybody a favor, stay home and be well.
Yeah,
Dr. Susan Bleasdale, Medical Director of Infection Prevention and Control at UI Health, who walks around in a full hazmat suit 24 hours a day.
The best.
Doctor, thank you.